This video continues Chapter 14 of OEC 6, looking at allergies and anaphylaxis. And in this video, we want to focus on the assessment of a patient with an allergic reaction. So we'll focus on signs and symptoms. When we assess a patient with an allergic reaction, some things don't change. We begin with scene safety considerations. What if someone that's part of your team actually has the same allergy? We need to be mindful and we need to make sure that we do not risk exposure of them. We'll move to primary assessment and talk about life threats, and depending on the severity of the patient's distress, that may be all that we do, is we just care for the particular life threats and wait for the secondary assessment until additional rescuers arrive. If there are no immediate threats to life, we want to proceed with the patient history and a secondary patient assessment head to toe, and keep monitoring ABCDs. This becomes our reassessment piece. That's because signs and symptoms are often evolving in an allergic reaction. They can change over time as that immune response and the allergic reaction increases and elevates over time. As a rule, if you see a respiratory impairment, this is the A and B of our primary assessment, understand that you're dealing with a potentially very serious reaction. Now, as part of your sample history, the A is obvious. Pay close attention to the allergies, including medications. If you understand this to be an allergic reaction, ask for details, pertinent medical history, not necessarily just other conditions they may have, but their response to a previous exposure is going to be important. And specifically, have they ever had a severe allergic reaction progressing to anaphylaxis? Have they been prescribed an EpiPen? Have they ever had to use it previously? Now, some medications they may have taken will show up in the M part of your sample history, and so a list of common oral allergy medications are here. One of the most common ones that we see is diphenhydramine or Benadryl. In the case of anaphylactic shock, we'll see signs of a severe allergic reaction. We'll see them moving towards this hypovolemic shock. It's actually a form of distributive shock because of the vasodilation. Symptomatically, they're going to present with a systolic blood pressure below 90 millimeters of mercury. They're going to have elevated respirations and an elevated heart rate. They'll be tachycardic. Their level of responsiveness may begin to decrease. They'll be less than A, less than alert, and possibly because of the constriction of the bronchioles and some of the edema in the pulmonary spaces due to the allergic response, we can actually see interference with O2 saturation, so a pulse ox will be less than 90%. Always make sure that we're treating the patient, not the number. If you see these things occurring, recognize that you have a severe situation. The patient is progressing towards anaphylactic shock, and treat them appropriately.